Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. We bring you Sound Health every Tuesday at 6:30 p.m. and we enlighten members of the public on trending health issues from around the world. Today we are looking at a general topic that affects women. Most new mothers experience mood swing during pregnancy and after childbirth. It could be mood swing, anxiety, crying spells, and all that during this period. What exactly is the reason behind this condition, and how can it be managed in mothers and nursing mothers? Stay tuned, the conversation begins after this break. The program is still Sound Health on Lagos Television. Sharing our expertise via Zoom this evening is Adebukola Adeogun. She is a mental health nurse practitioner and she is going to let us know what exactly is postpartum depression. Good evening, Adebukola Adeogun, and thanks for joining us.
Good evening, Zombo. Thank you for having me.
You are most welcome. Thank you for finding time to join us on the program.
Thank you.
10% of pregnant women and about 13% of nursing mothers experience mood swings, anxiety, some sort of disorder during pregnancy and after childbirth, which may last for about 1 year. What exactly is the reason behind this condition or development in such women?
Thank you for having me. Yes, you are very right, Zombo. Depression is something that we sometimes shy away from, and I feel like this type of depression postpartum is not just starting after childbirth. Sometimes it's before or during pregnancy. And then when they have a child, then when they have their children, then it becomes more evident. And it's something that we need to address. The specific reason or the cause of it is unknown, but we have things that are associated with it and make it a high risk for many people to experience this type of illness, mental health.
Okay, you just pointed out that it happens before, during, and after childbirth. How do I know I'm going to experience this? Are there factors that will predispose me to this condition, postpartum depression?
Yes. Thank you for the question. It's very important. No. So according to research, one in every five individuals, and I mean like women at bearing child, will experience some kind of a depression in their life. And it's also common in children, I mean, in female that go through a mood swing during their menstrual cycle.
Hmm. Hmm.
So they have a higher risk of, experiencing postpartum depression because of the hormonal issue that they already have prenatal. So that's one thing. And 75 to 95% of this, they go through postpartum depression. People, they have history of depression. Um, Before they even get pregnant, they have mood swings, they have just sadness, and they become so irritable, and they never seek any help. And some of the things that can cause you to have these um, symptoms or that put you at risk is either maybe you have a family who has gone through the same thing that you're going through. They have history of family perinatal emotional destruction, and it may carry on like that. Or some people, they have they are in the environment maybe in a relationship that is causing them to be depressed, then they get pregnant and have children, then that carries on, and the depression is more evident after they have their children. So if you, before you get married and you, or before you have a child, and you're experiencing some mood issue, and this would be, just being sad, lack of motivation, being isolating yourself from other people, you don't want to talk to people, or you just want to be by yourself, you shield yourself from, people that loves you, you stop doing things that you love to do. And again, having lack of sleep, you're not sleeping well, or you're sleeping too much. Some people, they even eat a lot, or they're not eating at all. So all these are the signs that you should watch out for. Then when you get pregnant and you have a baby, then it becomes really, really bad and more evident.
All right. Is there a difference between baby blues and postpartum depression?
Well, postpartum depression is more severe than baby blues. Baby blues may come and it usually goes away within a short time. Postpartums will linger around. Sometimes they say it lasts about 2 weeks, then it goes up to a year. So postpartum depression is more severe.
Okay, we've had some cases where they say this woman is experiencing abisinwi. Is it, can it be as bad as that if not treated early? Do you know what
Yes.
abisinwi is?
Can you refresh? I'm not.
Abisinwi.
Oh yes,
Yes.
Abisinwi. Thank
Yes.
you.
Yes.
I wasn't getting it when you said I was thinking.
Okay.
Yes, I mean it can really be as bad as that, because imagine that you have a disease. I usually use an example like you have high blood pressure. And high blood pressure, when you go to your doctor and you check your blood pressure reads about, let's say, 160, 180 over 100, or 120. Because we see the numbers, we act quickly. And when you see the numbers, you are even asking your doctor, what medication should I use? Because you are seeing the numbers. For mental health, because we are not seeing numbers, sometimes it makes us to overlook things or under treat it and not paying attention. Then everything linger, and at a point in time it becomes overwhelming to the point that people now become psychosis from it. And I think that's what you mean by
Yes,
addicting.
yes.
Then they start hallucinating and being really delusional and acting out to the point that they have to be admitted for them to be treated.
All right. Because you said this condition lasts up to 1 year or more than that, can it be treated? And
It
yes.
can very well be treated. We always advise, at early symptoms, early onset is better. So we can usually, when it's early, we do screening. Screening is not diagnosis, but it helps us to know at what stage you are. If it's mild, we can start with therapy and see how you're doing with therapy. But if it's really severe, we combine therapy and medication. And therapy is good because we encourage the patient to join like support group, like a psychosocial support group. People who are going through the same thing, it's always good to hear from them. When you hear from them, you see how the healing journey is. It encourages you to know that you are not alone, that at least you have other people that are going through the same thing that you are going through. So yes, it is definitely treatable, but we encourage people to come out early so that the issue can be addressed.
Okay. How can this impact the mother's health, and the child, as well as the family?
Yes, this is very important, because at this point the mother is not nurturing to her baby. They see their baby, sometimes they see their baby as a burden. They do not want to come close to their baby, and that will affect the baby. The baby may lack vital nutrients, because if you're breastfeeding and you are going through this episode, you don't want to be close to your baby. You are not feeding your baby, you are not nurturing the child. And the mother too, they will lack um, good nutrients, because at that point in time they either be eating too much, which is not healthy for them. They gain weight, they will see their body and feel like uh, they destroy their body, they start having that stigma. So we encourage that at that point in time, we want to make sure that the baby and the child are doing better by making sure that the mother get help that they need.
All right, Adebukola, there are so many myths and misconceptions about postpartum disorder. One of them is that people living with this condition are being bewitched or possessed. How true is this?
It is very wrong. This is why we need to educate people, to educate, because it's very important to, especially those who are in the rural areas, in the villages, to let them understand that it's not a wish, it's a witchcraft thing, it's not somebody doing voodoo to them. This is a severe, serious emotional problem that needs to be treated. And because, I mean, we've heard news about mother killing their babies, and people would think, oh, it's wish. No, it's because they have gone through that chemical imbalance in their brain for a very long time, and going through that without treatment, and like I said earlier, result into psychosis. Then they start hallucinating, seeing their babies as evil, or seeing their baby as a burden to them. So if they have started treatment or help at early stage, they will be on medication, they will be on therapy, they will be able to talk to people who have gone through the same thing, and that would have been avoided. So it is very important that we educate, and let people know it's okay. Stressful environments alone can bring out, you just had a baby, your body is changing, you have everything going on, especially new mothers and that have not experienced that before. I am myself, I'm also I will say a patient, but I experienced it with my first child. After giving birth, it was so overwhelming. And when you are in another environment that is not like Nigeria, that you have everybody around you, people that will come around you will stay a few hours. They have to work, they have to go, do their own thing. And I have my little son that time. I was overwhelmed. I had a C-section. I have to feed him, I have to get up. I was just overwhelmed, to the point that I told my mother when she came to visit, I said, can you take him away? Just take him away. I don't want to see him now, right now. But thank God, after talking to my OBGYN doctor, and she saw that I was going through that right there, she was able to talk to my family that, okay, you guys need to come around more, and one person should stay with her all day. And that helped me. I was able to get out of it. And so I can say I'm talking from experience. I might not have the full blown of the issue, but I can tell you that talking to people, especially, talking to professionals that knows a lot about it and able to treat and help you, will make a lot of difference. So yes, we need to educate our, uneducated people to know that it is okay to come out and talk.
And as we wrap up now, your final words to mothers or families experiencing this condition at the moment.
For family who are experiencing this condition, we encourage. The good thing about African tradition is when women have children, we have mothers who are very supportive, who are around. We encourage our mothers to pay attention to every little things, every little details. That will help the mother to get help. When you find out that your nursing mother is not nursing, their children as they should, we encourage you to help them to speak out to get help. or maybe they are not eating the way they should, we should not ignore those little things. They are not sleeping well, even after they have someone who are there to help them to care for the baby. We encourage those who are around them to help them in for them to get help.
All right. People experiencing postpartum depression needs all the encouragement and support. You need to monitor them closely. Adebukola, Adeogun, thank you so much for your time and expertise on postpartum depression.
Thank you for having me.
You are most welcome. I have been speaking with Adebukola Adeogun, a mental health nurse practitioner, on how to manage postpartum depression. Sound Health continues with trending health report from around the world. Please stay tuned. It feels okay to be overwhelmed. It feels okay to be anxious during or after childbirth. Seek
Yes.
help early enough. See a professional early enough. This is where we say thank you on today's episode of Sound Health. Please know that postpartum depression is not as a result of being bewitched or being possessed. You heard what Adebukola Adeogun, the mental health nurse practitioner, what she said or highlighted during the interview. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 08035826603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. Make healthy living your choice.